Kiwoko Hospital is a 31-year-old hospital. It's a 204-bed unit, and it's a private, not-for-profit hospital, which is owned by the Church of Uganda. And we're under the umbrella of UPMB. And it was started at a time when there were many poor people, and this has continued to be the case to date. The aim of the hospital was targeting healthcare for this rural, poor community. As of 2020, a program was started on antimicrobial stewardship, with the aims of trying to sensitize not only health workers, but also the community to the importance of looking after the antibiotics which we have. And at that time, we found that there were a number of problems which were existing. One of them was general lack of awareness on antimicrobial stewardship. And this was found not just amongst health care workers, but also in the community in general.
There has been reduction in the misuse of antibiotics in treatment of urinary tract infections, and there has been a change in treatment, provision of surgical antibiotic prophylaxis for patients that are undergoing surgery. For example, in obstetric and gynecology, we're using cefazolin now. There have been developments of various posters, various memos, various short messages that have been posted on the walls, on the notice boards of various hospital wards, that have been conveying messages of antimicrobial resistance burden. We've been able to also provide a few chats to patients on their way out to the hospital, conveying messages concerning antimicrobial resistance burdens and misuse of treatment, refusal to finish treatment as prescribed.
Internally, we found we also had challenges with testing antimicrobial resistance patterns, and especially when it came to the area of blood cultures.
To the patients that we work on, they are coming from poor communities. They are not able to pay for some of these services.
In the community in general, we have found that we have had many challenges also with antimicrobial use. And this is often characterized by people not completing doses. For example, someone will start a dose of antibiotics and take out of 5 days, take 2 days, and stop the dose because they're feeling better.
So as Kiwoko Hospital, we have been privileged to work with MTAPs. As a hospital, we are focusing on procuring a blood culture machine that we are able to fix in the lab so that we shall be able to culture all the samples that we shall make informed decisions. Because Kiwoko, being that we train the nurses and the midwives, and also we have other medical interns that are always posted here, we are looking at making these standards so that these trainees, once they leave Kiwoko, they are able to take this information to other areas so that we shall improve care of patients in such areas.
But we still feel that there are many gaps which need to be addressed. And it's in that spirit that we have approached this proposal to try and get more support to enhance antimicrobial, but in the community, with the hopes that we can establish a center of excellence which can also teach many others about antimicrobial stewardship. Thank you very much.